All right, the clock says noon. I trust everyone can hear me. I just want to first and foremost welcome everyone and thank everyone for joining us today. I know everyone's busy schedule and just appreciate you taking some your lunch hour and joining us. So Don and I and the rest of the board would first and foremost just want to apologize for last week. Certainly had a good turnout. Just unfortunately couldn't get it broadcasted. So thank you for allowing us to put this on today, and we will get better at these things. So for those of you who don't know me, my name is Kurt Marks. I'm the president of HESNI. This is my second year, and look forward to serving this group as all of the board does. Just want to thank this group for allowing us to serve you, and I always want to take this time just to plug the board a little bit, because these things aren't easy. It's hard to schedule time out of an already busy day, and so I always want to thank the board for donating their time as they have. At the same time, to the rest of the members, I always want to encourage, if there's anyone out there that wants to serve and give back to HESNI and ASHE, reach out to us. There's always more work than available hours for volunteers to do. So if anyone wants to get engaged with the board, just reach out to any one of the board members, myself or Ryan or anyone on the board. We certainly would get you teed up, and there's certainly a role for you to serve. So. As we look back, and again, I only want to take just a couple minutes, as this is our first meeting of the year. As all of you know, times have been challenging, and it has been for HESNI too. And so we look forward to the next few months as we try just to do different things in different applications with virtual meetings. We're going to try to bring more, whether it be monthly or every other month, to this group. So we hope that we bring value to your time and to your membership. A few things that are on the calendar. We still are planning an annual conference. Now, we don't know if we're going to be able to do it, but our plan is to move forward with that. So we're still taking abstracts, and we're still putting together an annual conference, which currently is scheduled for June 10th and 11th. So it's about the same time that we typically do it. I think it's a couple weeks behind when we generally do it. Just a couple of housekeeping notes. All cameras are turned off except for the presenters, John, myself, and Don. And the same with the mics. They've all been muted. So any questions, please put them in the Q&A, which should be in the top right corner of your screen. We'll grab those questions and get them answered at the appropriate time. If it seems appropriate, John's given us the okay just to cut in. If it feels like a more of a general question, we'll plug it at the end of the meeting here. So I do want to welcome Jonathan, and he's been so supportive of advocacy, not only for HESNI, but for all ASHE, and represents all of our groups in healthcare well. I just want to take a quick minute and just read his bio. Bios are kind of always cheat people, because there's so much more than just a paragraph. In Jonathan's case, that is certainly true. He is so much more than just a paragraph, but I'll read his bio, and then I'll turn it over to him. So Jonathan is the Senior Associate Director of Advocacy for the American Society of Healthcare Engineers. In December, he was selected as a member for the International Code Council's 2021 Group A International Fire Code Development Committee, which evaluates and recommends code changes. Jonathan has a master's degree from the University of Arkansas for Medical Sciences in Health Service Administration. So Jonathan, we welcome you, and just appreciate you taking out time of your day. And I know you took out time last week. And just so this group knows, John was kind enough to schedule this in the evening, so we just do a dry run. So all of this is just his time that he's donating to HESNI. So just appreciate your time and what you do for our society, John. So I'll turn it over to you. Hey, John, hate to do this to you, but I think you're on mute.
You're right, Kurt. I was.
Sorry about that. You're live.
One of those great opportunities we have with these virtual meetings. You know, I like to keep it muted so you don't get any of the background noise while you're talking, but forgot to unmute. So I just want to make a plug real quick for the board and the time that they put into it. You know, I've had the opportunity to serve on chapter boards before and understand the struggles, but also the dedication and the opportunities to serve. So we do have quite a bit to cover today. We're going to talk about some of the advocacy efforts, and let me go ahead and start by sharing my screen so you'll be able to see the slides. Go to presenter mode, and then I have to flip my screens. There we go. So we're going to talk about the ASHE advocacy efforts and what we've been doing lately. Kurt's already given my bio, and Kurt, I don't know that I even warrant a paragraph beyond a sentence, let alone a paragraph. But the most important part on this slide is my contact information. You have that contact information there. Please reach out if you have questions or if there's anything I can help with. We're going to talk about several different things. I'm not going to read the agenda, but you know, ASHE advocacy is very engaged and had a very productive year last year, and we're off and running again this year. As Kurt mentioned, have the opportunity this year to sit on the ICC Fire Code Development Committee, which has a lot of input into the changes that will happen in the International Fire Code, which of course impacts all of us. So, but we're going to talk some about NFPA. We're going to go over some ASHE stuff that we're doing. We're going to talk about some FGI stuff, and we'll get into some of the actually more impactful issues, as I see, as our COVID resources and some of that stuff. And I'd like to make a plug for our ASHE YouTube channel. So let's jump right in. We're going to talk about an NFPA update. So NFPA, you know, they have their annual cycles. NFPA has a cycle going on every single year. So right now, the 2021 editions, all of the NFPA codes and standards that were published in 2021 are now available. So those standards are just restarting their 3-year process, and we'll talk about that at the end of this slide. So those standards, which are due to be published next year, 2022, they're in what we know as the NITMAM process, the Notice of Intent to Make a Motion process. And you see the codes there. 1072 really impacts us significantly. The NITMAM closing dates are February 17th, so it's just around the corner for us. The next group of codes that NFPA is working on are the ones that are published in 2023, 14, 25, and the most important one probably for us is 70. Those public comments were due or are due by January 5th of next year. The public comments are not public inputs, so let me explain a little bit different there. Public inputs are what start the process. Once those are in, they publish those comments or the inputs that everybody has made, and you have the opportunity to make a comment to the inputs. When you're in the public comment process, you can't make additional changes. All you can do is comment on what inputs were made. So that's where we're at with the 2023 cycle, and going further, the 2024 cycle. Those codes are 70E, 90A and B, 99, which is a very big one for us, the Healthcare Facilities Code, and 101, the Life Safety Code. Those are currently open for public input. So if you have an issue with any one of those codes or any of the codes that are in the 2024 cycle, and there's definitely way more than the 5 that I have on the screen here, those inputs are due by the 1st of June of this year. So now's the time, if you've got a concern with, 99, a medical gas issue that you keep bumping into, get that input right now. Now's the time to get those done. You can find this type of information for any one of the standards by going to nfpa.org/ and the standard number, and then looking at the next edition tab. If you have issues, like I mentioned, now's the time to submit it, but maybe you don't know how to do that and you've never done that. That's okay. We put together some videos for you, and there's the web address that you can go to, how to actually submit a comment, a public input into the NFPA process, or a public comment, or even to work on a NITMAM. They're all in there. We also have ones that I'll mention a little later on in regards to ICC and ASHE processes also. Now, if you have a question in regards to the language and what the actual interpretation needs to be or should be, that's a little different process than making a change to the code itself. So to get an interpretation, you submit a request for information to what's known as the Healthcare Interpretation Task Force. And I have that website there for you also, so you can look into how to do that. Of course, Don is your advocacy liaison, and Don's been attentive and attending several of our training sessions, etc. So he has the way to also additional information, or can help you, assist you with submitting some of those things. Here's some of the things that we have been working on. One of the things we did is we did a research project in regards to items touching the sprinkler system and the impact that those have. So we provided that research information to the technical committee, and they've made a change that is in process right now. So this is an input, and it's open for public comment right now. So and this is what the change was. Not ideally what we would love to have seen, but you know, it's an improvement over what we had. So the intent is that the piping and hangers shall not be used to support non-system components. So definitely an improvement over, you know, hopefully this will get away from, you know, a Cat 5 cable draped across the sprinkler pipe. It's not supporting that that component. It's just touching. So there is still going to be some interpretation issues here we see. You know, clarification isn't as nice as we'd like to have it, but it's a step in the right direction. So that's there right now. We do expect that there will be a bit of opposition to this, but we're going to continue to advocate for reducing that to a reasonable expectation, where we know that you know, a Cat 5 cable on a sprinkler line is not impacting that sprinkler line at all and not causing damage to it. So we want to make sure that we're getting to that point where those things can kind of reduce the input on that. Monthly inspections covered under annual inspections. This is within NFPA 10. One of the issues that we have seen is that we've had members that have reached out to us that they were cited for the fact that they did their annual inspection on their fire extinguishers, but they got cited for the fact that they didn't do the monthly one, when the annual inspection includes everything you need to do for the monthly and more. So we have worked out, we submitted a request for change on that, and that is included now in the public input. Again, they're taking comments on this. So we're hoping this goes through, and you won't have to do both, document both your monthly and your annual. You only have to document your annual when you do those. Some of the other stuff that we're working on, we know door gaps has been an issue for a long time. So ASHE is actually partnered with the NFPA Research Foundation, and we've been working on doing some actual research on door gaps and the impact that the gaps have. We've actually had 9 doors put together for us, manufactured, put into a fire to UL, given to UL, and UL actually burned the doors for us. So to determine what the differences are when gaps are a little larger, gaps are, you know, and that's our goal, is to see if we can make an expansion on some of those gaps. So that's a real important one. Of course, when we ran into the COVID-19 19, we ran into some issues and being able to finish up some of those. So we're still continue to work forward with that. We've got some more research to do. The plug load demands tables, we know that this has always been a controversial issue within 70. So we've actually partnered again with both NFPA and ASHE to do a plug load demand research project, and we're going to be moving forward with that. This one has really been impacted by the COVID situation because the demand that we were actually all scheduled to go in and set up the meters and everything in April of last year, and of course things hit and we weren't even able to get the meters installed. So we've been actually delayed an entire year. We've been able to find a few facilities that are willing to let us in here now, so they're in the process of getting those meters installed, and we'll start tracking that data to see what the actual real demand is, and hopefully be able to reduce some of the requirements within the demand tables. Another thing that we're researching is cybersecurity standards for fire alarms systems. We know that there's been we haven't had any actual breaches that we know of yet through fire alarm system. So we want to make sure that we do that research now and get the standards right so that we don't have to worry about those. Again, I mentioned, that we're in the NIPMAN process. Just wanted to emphasize this again. We have those videos there. If you want to watch those, please do, or reach out to Don. He can help you there too. Let's talk about ASHE. And Kurt, again, if any of the questions come in on any of the NFPA stuff, just jump in and let me know. ASHE, we've been working diligently with ASHE. We've got several volunteer members actually working on some of these things. And we also have staff involved. It's just ASHE has so many standards right now that are impacting us that it's hard for the staff to cover them all. ASHE Standard 170, of course, the ventilation for healthcare facilities. That is going to be republished this year, and we're going to have it included. The plan right now, we've made an agreement with FGI that since we've made some changes that I'll talk about here in a little bit to that standard, that they're going to go ahead and include it in all 3 of the FGI guideline documents now. ASHE 514 is a new standard that is in the process of being developed. It's the risk management for building water systems, physical, chemical, and microbial hazards. I'm sure there's thoughts going through people's minds, well, isn't that what 188 covers? ASHE 188 is really focused on Legionella and water management and how to manage your water systems so that you avoid Legionella. This expands that into all microbial hazards and also chemical and physical hazards too, such as scalding and metals in your water system, etc. ASHE has been very engaged with this in regards to the healthcare facilities and the impact that might have on them, and making sure that it does continue to align with our current requirements for water management programs through our accrediting organizations, through CMS, and also through 188. This document is going to be coming out in an advisory public review in March next month. Strongly encourage everybody to read through it, to take and make comments back. An advisory public review is really the first opportunity for an ASHE standard, and since this is a new standard, to get public input. And that's what we really want here. So encourage you to watch for that. Now, I've got a slide a little later on to tell you how you can find out when that actually goes out for advisory public review. ASHE 189.3 is the high performance healthcare facilities standard. The work groups there have been finalizing alignment with 189.1, which is high performance facility or high performance buildings other than residential buildings, and 90.1, which is the energy code. So we're aligning all of it with that. We've actually got a process ongoing right now in which one of our staff members, Benjamin Lutzi, is actually doing a crosswalk between all of these documents and ASHE 100 really make sure they line up. And we've already found that there are conflicts. There's different requirements in the different standards that conflict with each other. So we're trying to get that all laid out so we can figure out where those issues are and resolve those. A fairly new one for us is ASHRAE 100, Energy Efficiency in Existing Buildings. We were made aware of this through an advocacy liaison out of the state of Washington. The state of Washington has officially adopted this document in a progressive process in which they're going to have the energy targets in place in 2023, and that if the facilities don't meet those targets, they could suffer fines from the state of Washington. When that was brought to our attention, we started digging into this, and we realized that ASHRAE 100 had some unrealistic targets when it came to healthcare facilities. So we're working with that standard and that committee to better improve those and make sure that those targets are really what they need to be. So those are some of those efforts that we're putting forward there, and really a lot of work going on in the ASHRAE environment. Not going to go through all of these, but wanted to make sure that I listed all of the different addendum. When ASHRAE republishes a document, so we currently, the Ventilation of Healthcare Facilities ASHRAE Standard 170 is a 2017 edition. It's going to publish in 2021 this year. And what that means is it's going to take all the addendum that have happened prior to or since 2017 and prior to 2021 and make them an official part of the document. So it's just publishing the approved addenda. And we've got several of them here. I just want to point out a couple of them. Addendum J is a very important addendum. It establishes tables 8.1 and 8.2, which are the specialty outpatient and the general outpatient spaces. This was one of the controversial issues that came up that FGI was concerned about, because when they created an outpatient book, there weren't specific outpatient spaces in ASHE 170. So we have created that now, and those now exist. That was a 2.5-year process in which we went through. It's been published, it's finalized, it's out there, and of course is under continuous maintenance. We have several others. Addendum K issues Table 9.1, which is the residential healthcare and support spaces. And then Addendum F is a clarification for our airborne infection isolation rooms. It's real important that that clarifies how you can actually recirculate air within an AII room, and that it can't be recirculated back into the system. So that was a real important clarification that came through a request for information, honestly, from an individual, an ASHE member who submitted a request, wanted to know, hey, is this what it really means? And we clarified that it wasn't, and so we made that clarification through an addendum also. So as I mentioned, ASHRAE documents are under continuous maintenance. That means proposals can be submitted at any time, whereas NFPA and ICC have very set timeframes when you can submit proposals. Here you can submit one at any time. So ASHE makes an effort to make sure that anytime an addendum comes out to one of the standards that impacts healthcare facilities, we publish that within our Health Facilities Management Insider electronic newsletter. So please watch for those. They always come out in this type of announcement, as I have shown here, ASHRAE 188 addendum open for full public review. We tell you what standard it is, and then provide you a link on how to get to that addendum and what the changes are. And again, strongly encourage you watch for those, and when they come up, jump on there, review these, and make sure that what's happening is what you want to happen. We also have some sustainability efforts going on. These are not new to ASHE, but we know that there's a much larger focus on them coming up. With the new administration brings a brand new vision for sustainability for the future. So we're seeing significant emphasis already on targets like what I mentioned earlier, ASHE 100. The state of Washington has adopted it. You know, we see many other states. There's several other states that are looking at it, and we know the state of Oregon is looking at that. The state of Massachusetts is also looking at it. So be aware. I have not heard anything about Illinois looking at ASHE 100 yet. So, but need to be aware that those things are happening, that this is going to become a much bigger emphasis. Would encourage you to look at the Energy to Care program that ASHE has. When we presented our information to ASHE 100, the committee there, what made our argument so strong and them willing to relook at all the healthcare facilities was the fact that through our Energy to Care program, we had hard data about how the best facility that scored 100 on Energy Star would not even meet the energy target that was going to be required within the state of Washington. So the best facility that's doing the best it can when it comes to energy conservation wouldn't even meet the requirement, the minimum standard. So that's why we were able to show that. But what we would like to encourage is get involved with the Energy to Care program, because again, you know, EPA relies on our surveys and our data to establish those scores. And we can also use that to look at establishing the targets for energy targets coming up in the future. We want to make sure that we've got the right data. Going to jump into ICC. We've got a lot going on there. The International Code Council, of course, we know these are the building codes and fire code that really impact us the most. Mechanical code and plumbing code also impact us. The ICC is starting a new cycle, as they call it. Group A cycle is already in process. The deadline to have those submitted was, all the proposals was the 11th of January, so last month. The International Code Council Committee on Healthcare, which is a ICC and ASHE sponsored effort. So we have ASHE members that facility managers that sit on that and have direct input to that. They submitted 14 additional proposals. I have several other dates on there as far as the process goes. Just be aware, there's a committee action hearing coming up in April. From there, the committee votes on those proposals. They go into a public comment process, so then you can actually submit comments on it. And then those public comments there's a hearing in September on those. So that's the process here. The upcoming code action hearings are going to be virtual. So it's going to be a bit different, but the cool thing about this is this will actually allow people who couldn't travel to Rochester, New York, to actually participate in and testify and participate in the code action hearings. So want to encourage you all to be aware of that. If nothing else, tune into them and actually watch them and take some time to you know, while you're doing some other things, just have it going on in the background or something, so you can see the process that what we call the sausage making process to how we develop these codes and standards. Give you the dates there, and you can go to the ICC. ICCsafe.org is the website where you can get more information on this. As I mentioned, the Committee on Healthcare submitted several proposals. We have 3 different work groups: general, which really looks at means of egress and type issues. The fire and safety group look at life safety and fire and safety issues. And then the mechanical, electrical, and plumbing work group work on all the other stuff. So our efforts this year were to continue to focus on the K tags and the updated K tags, and to make sure that the I codes align with the requirements within the K tags. I'm going to touch on just a few of them here. I have all 14 of them listed there, but just going to touch on a few of them. Control vestibules. This is one where you have an interlocked vestibule door. Believe it or not, well, I'm sure some of you on the phone may even be wanting to have some of these. You know, we see in the inner city areas that these are becoming more prevalent, and of course, they're a major impact to your means of egress. So that's a big one that we're looking at. The lay-in ceiling tile and smoke-tight construction. This is one of the conflicts that we have between the codes. NFPA 101 allows you to consider the lay-in ceiling as a smoke-tight construction for your corridor. The International Building Code does not allow that. So, you'll have, if you have an AHJ that's not particularly focused on 101, they actually will require you to build your corridor walls all the way up to the structure above. And then when you have your surveys done, they're not interested in looking at whether they're a firewall or not, because they don't consider them a firewall above the ceiling. So we're trying to get that worked out. We've been working on this for going on 12 years now. We have some additional data that we were able to obtain through advocacy liaison efforts, and we've submitted that again. We'll see how that goes this go around. Transfer error, this is not a big issue, but one of the issues that we realized that when we're maintaining pressure differentials in our AII rooms or positive pressure rooms, we're actually causing transfer error, as it would be noted, and the mechanical code doesn't allow that. So we're fixing that with an exception. Let's see, moving on. One of the more interesting ones is we had a proposal come forward and the committee approved it in regards to cold water hand washing. One of the issues we know is that water that is between the temperature of 85 and 110 is ideal for propagation of pathogens, Legionella being one of those, Pseudomonas being another. So by keeping the hand water or the hand washing stations within patient care areas at a temperature below 85 degrees, which doesn't meet the tempered water requirement of the mechanical code, or the plumbing code, sorry, International Plumbing Code, we could actually help reduce maybe some of those the spread of those pathogens. So that's one we have put into the International Plumbing Code. I know I went through those fairly quickly, but hopefully they make sense. Again, they will be coming out in March for review. They'll go through the committee hearing process, whether they get approved or disapproved. There will be public comments from that point. So keep an eye on those, and of course, ASHE will keep you up to date on where those sit. FGI, another very important standard that we have as it gets adopted, we know, throughout the country. So the 2022 edition is almost ready. It's gone through the draft. It's gone through all the public input and the process there. It's even had the final comments put in by the HDRC, the governancing committee, and it's just being finalized. They're in the process of putting the document together and getting it ready, edited, final editing done, and that kind of stuff. One of the things that is going to be up for public review is the FGI's emergency conditions guidelines. It has been drafted and it should be coming out for public comment here any day now. Of course, we will have an alert on our website about that, and it'll go out through our electronic newsletters, so watch for that. It is intended to be issued as an adoptable guideline. So these will be the guidelines for whenever there's a pandemic or a natural disaster or of that nature, that happens, that if adopted by your local jurisdiction, you'll have to follow. They basically broke it down into 4 different types of timeframes: immediate responses, temporary responses, semi-permanent, and due to COVID-19, permanent responses. So something to be aware of. I strongly encourage you to, again, look at this document as it comes out and make comments to it. Let's go through quickly some of the different requirements or changes that are coming up for the guidelines, the 2022 edition. They've added acoustical requirement to the safety risk assessment. So that will be where you'll have to do a risk assessment, or your safety risk assessment will include acoustics to it and noise risks. So they've included some acoustics for telemedicine spaces. That was a fairly late change. You know, with the increase of telemedicine over the last year, it became apparent that there were some requirements, or they wanted to establish some requirements for noise reduction coefficients for this. So that's the acoustical stuff. One that is known as Laura's Law. This comes from an incident that happened in Massachusetts, where an individual by the name of Laura was was in a medical condition and wanted to get to the ER, was on foot, came to a door that was near the ER, but not the actual emergency door into the ER where the ambulance comes. And no one was there. The door was locked down. There was no surveillance of the door, and she ended up passing away. So Laura's Law is now part of FGI, where video surveillance at public entrances will be required, and duress alarm systems where entrances are locked. So if you have doors that you lock during the off hours that someone could present to a public entrance, you'll have to provide a duress alarm system for that. Now, again, this is for new design and new construction. It's not retroactive within FGI, that is. I know in the state of Massachusetts, it is retroactive, and they're requiring that all hospitals to put that in now. The airborne infection isolation rooms, there's a change there. You'll have to analyze your new AIIR rooms, and determine if an anteroom should be included, and that if the anteroom is deemed to be included, should space be included in the anteroom for donning and doffing of PPE. So that's a fairly big change. There's a change in the FGI in regards to waste anesthetic gas disposal systems, WAG-D as I call it. There's language now, NFPA 99 has always had language in it that wherever you have inhalation anesthesia administered, you have to have a WAG-D system. What we've seen over the last, several years, 5, 6, maybe even last decade, is that they're using nitrous to calm people, you know, and using it in areas that weren't originally established for anesthesia. So they don't have a WAG-D. So FGI is now going to have the same language as NFPA 99 does. And if you're doing those kind of things, I'd highly recommend you talk with your anesthesia department, find out where they're using different sedative or anesthesia gases for a calming effect on patients. That's where we're seeing this. Advisable, it's recommended. Well, NFPA 99 has always required you to have a WAG-D at that place, and most time they don't. So that's a citation we're seeing more and more often now. Free hospice or palliative care units. That's if you decide to have one of these, FGI has now included some requirements for those. Emergency room low acuity pods. Those are, you know, within your ER, instead of having a bay with a stretcher or a gurney, they're putting in like chairs in which you can take and do low acuity things and stuff. So they've provided those. Again, these are not a required part of your emergency room, but if you're going to use them, they're giving you the minimum requirements for this now. Behavioral health crisis unit, again, has been added as if you're going to have a behavioral health crisis unit. Those are, they've provided the access, or they want it to be accessible to the emergency department, and they've provided some updated information for that. Freestanding emergency departments, these are becoming more and more prevalent across the country. Again, low acuity pods are allowed in those. They're going to require flexible, secure treatment rooms. So one of the issues there is that they've noticed that that a lot of folks are designing these with just bays, and there's concern about security within them. So making sure that they're in an actual room, that they have a hand washing station, and those kind of things. Again, linking back to the behavioral health crisis unit, if you're going to have a behavioral health crisis unit at your freestanding ED, you have to provide equivalent as if it was at the hospital. So another one that's going to be very interesting is extended stay centers. These are requirement or are spaces in which you're doing outpatient type surgeries, and then a patient needs to stay overnight. So there's some really tricky requirements here, because again, you're building it as an outpatient facility, but you're doing hospital level care at that point. So there's monitoring and making sure you've got emergency provisions there is very important. So those are the big changes for FGI in the 2022 edition. Of course, they don't go in effect until they're adopted. The 2022 edition hasn't even been issued yet. So remember, check with your local AHJs and what you're having to actually continue to follow. We just wanted to make sure you were aware of those upcoming. Some of the other things that we're doing as an advocacy team at ASHE is we have what we call our MTTF. This is the Member Tools Task Force, and we've been doing this now going on, we're coming up on this is our 5th year, where we actually take and this time we worked with the advocacy liaisons and had them work with their chapters to take and put forth topics that are hot topics, as we call them, that need to be addressed. And so those were submitted, they were evaluated by the liaisons and our regulatory affairs committee, and then were ranked. And that determined which items we're going to address in our Member Tools Task Force. Let's see, just this month, we had an article in regards to the upcoming changes in codes with an NFPA code change submissions. The J and F stands for January and February. So you can see I provided you the chart. You can kind of look through this. Some of the big items that we know that, well, the ventilation management plans. We've moved that out to March so that we could do a full article on it and really research and find some of the best examples and provide you with some really good information on that. This is becoming more and more prevalent within the industry. These are very similar to your life safety plans, where you use a ventilation management plan to denote the rooms that have ventilation requirements such as negative pressure, positive pressure. It's just a lot easier way to actually see which rooms have those requirements on them and to be able to track those and manage those properly. Yeah, let's move on. So and that's the rest of them. Life safety drawings is another one that scored fairly high. You know, we continue to see life safety drawings being cited by surveyors as not being complete, not being up to date, not being managed properly. You know, just want to stress the emphasis that your life safety plans are the foundation of your life safety program. And I know, you know, over the years, I personally, you know, when I first put together a set of life safety plans, man, a long time ago, almost 2 decades ago now, you know, we drew them up, we noted them, and we showed them to everybody. We stuck them in the drawer, and they sat there until the next survey. That's not the way to be using your life safety plans. You know, we want life safety plans to be something that you're using on a regular basis, You're using them to train staff. You're using them to help staff understand where your compartments are, and not your staff, not the facility staff, but the clinical staff. You know, the EVS staff, your IT staff, so they understand and have a set of drawings so that they know what a fire barrier is, and that if they penetrate that, it's got to be sealed properly. You know, so that your environmental services staff can know what doors are rated doors in a fire barrier, and so that they don't prop it open and leave it propped open. So anyway, I'll get off my soapbox. Life safety plans, make sure you're using them and really being part of that. COVID-19, maybe you're wondering, what does advocacy have to do with COVID-19? Well, the advocacy team took it upon ourselves at ASHE, took it upon ourselves to put together a couple teams and to actually help manage and drive the resources that we've developed on our website. There's the website URL. It's ashe.org/COVID-19 resources. We have created well over 100 different resources for you. And, you know, we've got over 20 tools there that, you know, one of the big issues we're seeing come up again, this kind of cycles through. We've about every 4 months, we're seeing that there's an oxygen issue somewhere in the country. We have on our resources pages a template that you can use to determine what capacity you can actually serve off of your system. And that template has been downloaded literally hundreds of times. It's being used, but yet we know that the failure of a lot of the times these systems is because they haven't tracked or haven't determined what their capacity is, and they exceed their capacity. You know, some of the current treatment measures have increased the use of liquid oxygen. And then what we're seeing also is that a lot of facilities are starting now, because of the increase in the treatment methodology and the increased usage, they're bringing in cylinders to help supplement the usage. The problem is they don't have a good process to track those cylinders and make sure they're getting, when they're empty, getting returned and filled and getting brought back. So what we're running into is a shortage of cylinders because they're stuck in a room somewhere and they're not being processed and tracked properly. So we have a big article coming out on that in next week's HFM Insider. So I encourage you to read that and look at some of the recommendations we have there. But again, those web pages, there's literally, I think there's 7 different web pages, hundreds of resources, and many tools you can look at. Due to the work that we've put in, we've been asked by the CDC to become part of the Project First Line. The CDC is running this project, and it's an infection prevention and control training collaborative, how to train people to do things properly. So just wanted to make you aware that we're continuing our effort there and have been invited to participate in this project. One of the other things I wanted to make folks aware of is our ASHE YouTube channel. There's the URL for that. This YouTube channel, it's a partnership with Legacy FM, and it actually has, you know, different little video clips. We have maintenance and operations issues. We have energy conservation measures on there. We have soft skills, you know, how to output versus outcome. That was one of my favorites that Lindsay Brackett did for us. Most of the M&O stuff is done by Josh Brackett, and he actually shows you how to test a pole station, shows you what they should be doing when they're testing your fire and smoke dampers. That's the one that published just today. You know, what should they be doing to test a flame detector, so that we know what should be done. Encourage you to go on, subscribe today, and then there's the bell. The bell gives you notifications of when new things are being published. So click that bell so you can get notified, and share these with your staff. These are free, they're good training. Josh did one on fire extinguishers, how to test and do the monthly test on a fire extinguisher and inspection. So, good stuff. Hopefully everybody already knows all this stuff, but it's a great opportunity to do reminders. And if you've got new staff, great opportunity to train them. Some additional efforts that we're doing, we've developed a national strategy where we're getting additional representation with co-development organizations. I've mentioned that we've got NFPA and ASHE and ICC already, and on FGI, but we're continuing to work on that. One of the things I wanted to mention here, we're always looking for volunteers to help with that. If you'd like to volunteer to work with some of those committees and stuff, shoot me an email. Some of the big wins we've had lately, within NFPA, rated doors and non-rated barriers are no longer required. Well, once the 2021 edition of the Life Safety Code is adopted, it'll no longer be required to be part of your program. This whole take the label off, mask the label, paint the label, do whatever. If it's not in a barrier, it's not a fire door. And we have language in the latest edition of NFPA 101 that it does not need to be part of a barrier program. Monthly inspection of exit lights is being removed. This is a direct result of the advocacy, what we call the advocacy highway. We put out a call to the advocacy liaisons requesting people to submit their data on the inspections of exit lights, and we received 86 different respondents that had over 6,000 exit lights being tested on an annual basis. We took that data, submitted it to the committee, and were able to, from the data, we were able to determine that there was a 0.0004% failure rate. So that's 10,000ths of a percent failure rate for LED exit signs on a monthly basis. Why in the world are we spending time looking at them? So we submitted that. The committee agreed with us. So again, working with our advocacy liaisons and the advocacy effort and your input, we were able to get that inspection removed. It should be noted that exit signs connected to or provided with a battery-operated emergency illumination source. So if it's battery backed up, that still needs a 30-day monthly inspection. What I would recommend there is you look at an alternative equipment maintenance program for those, track your own data, and show that you can do that maybe quarterly or semi-annually. So those are a couple big wins. Another one I wanted to mention was the documentation of alcohol-based hand rubs. Don't know if anyone's been cited for not having documentation that you actually tested every single ABHR dispenser when a refill was put in. Just crazy how, so that was never the intent of the standard. The problem is manufacturers have that in their manufacturer's literature that you have to test it. So surveyors were looking for that documentation. We have now got that into the Life Safety Code that does not need to be documented. Already talked about the outpatient spaces being included in the standard 170 for ASHE. Again, just want to mention that our liaisons are so vital to this effort. So make sure you talk with Donnelly, and if you've got issues, get with him. He can run that up the line, and we can help you on that. I know we're starting to get close to the top of the hour, so I'm going to go through these even quicker. We've developed a rapid response team for ASHE. This is a set of facility managers, IP professionals, safety officers, AHJs, where we take and discuss these things on every other week. We have a call and we discuss different issues that are coming up, and we want to know what the hope of this is we can learn about these issues quicker and actually respond to them quicker. So, the COVID, this is a direct result from our COVID teams that we put together. It worked very well. We were able to get resources out to members much quicker, and we want to do the same here. Briefly want to talk on the spare breaker position. You know, if you're not aware of this, it's real important. The intention is that spare breakers should be in the off position, not in the on position. So be aware of that. There is not a code requirement for that. We're going to work with that and try to get consensus on this and figure out what do we really want those in, because there's arguments on both sides that are very valid, whether it should be in the on or on the off position. So we're working towards that, but right now be aware that it needs to be in the off position. There's also the requirement that was pushed by CMS that for spare sprinkler heads, be aware that this is, I don't want to call it a direct conflict. We understand the code is the minimum requirement. CMS has decided they want to increase that requirement. So there's a news out on that, and NFPA just issued something on Tuesday, and I failed to put that in this slide. I should have had that in here. But you can go on the NFPA website and just search for spare sprinkler heads, and it'll show you what their statement on it is. Performance-based fire extinguisher inspections. This is one we've been working on now for we're going into our second cycle in NFPA 10. We submitted data and everything. Unfortunately, the committee did not accept our comment, so it's not going to be it's not in the 2022 draft report. So it's a dead issue right now. But what we want to do is we're going to submit it again for 2025. So we're going to continue to ask members to submit their information. You know, again, this failure rate's not as small as the exit lights, but it's still a 0.09% failure rate for monthly inspections on fire extinguishers. So we want to continue to show that, you know, it's we're spending time doing stuff we probably shouldn't be doing. With that, I'm going to go ahead and stop my screen sharing. Let's see, give me just a second. Gotta get back to here to do that. There we go. Kurt, did we get any questions or anything? It's pretty quiet.
No, we did. I missed one that was earlier, but I'm going to save that because the second one that came in is relevant to what is going on, to your conversation right now. Regarding the removal of the monthly exit light inspections, will the hospital be required to obtain a waiver if it is determined monthly inspections are not needed?
All right. So again, that's we're held to the 2012 edition, and that monthly inspection is required in there. There's two efforts that we're going to make here. One, you can do right away. Take and let's start working on alternative equipment maintenance program for your exit lights. Go back, look at your last 2 years of data, pull that together, show what your failure rate is, and then extend it to semi-annual or quarterly, whatever you feel comfortable with. Take that data, run it for a year, extend it. In the meantime, ASHE is going to work with CMS to see if we can get a categorical waiver issued so that we can accept that requirement right away, and then the alternative equipment maintenance won't be required. But you can start working on that right now. And if you would like to use some of our data, we will share that. That was submitted by our members with the intent to be able to share it. Of course, it'll be sanitized. Nobody knows whose the data came from. We want to make sure of that. But we'll gladly share that to help you support your AEM. So that's the recommendations there.
Thanks, John. And then one that came up earlier in the presentation, I just lost track of it until now. It has been written that Congress wants to get involved with the development of the IECC going forward. Yeah. What should we expect from this involvement?
Boy, what a question, Kurt. That's a great question. What should we expect? Well, here's what you can expect. ASHE will be involved with that process, and we will stand strong for hospitals. We're not going to allow them to put out targets that we can't meet that'll, cause facilities to be fined. So we will be involved in that process. We're already tied in. Myself and Chad Beebe are both part of that process already. Kara Brooks, our sustainability manager, like I said, is on the ASHRAE 100 committee right now. What we can expect, though, are going to be energy targets for existing buildings. They are coming, folks. They are coming. You will need to meet a target. In effort to kind of get ahead of that issue, we are expanding our energy to care efforts. AHA as a whole is very in tune to this. What we are doing is we are working with the AHA board members right now. So that's the board members, the CEOs of the hospital systems that are board members for the AHA board. We are working with them, showing them their data. They've requested it, so we're providing that to them. So be aware, if you're not into energy to care already, your CEO may be asking you, hey, where's our data? Because it's going to come down from the CEOs now. The really good thing is the AHA CFO has taken a direct interest in this, and she is now part of our process to do this. You know, energy to care program has been going on for over 10 years now. And we've got a lot of data there that's really good data. And that's what makes it so, that's what's given ASHE the credibility to be able to say, hey, wait, ASHRAE standard 100, those numbers aren't valid. It's because we've got direct data from our members. So again, strongly encourage you, if you are not currently participating in the Energy to Care program, reach out to Kara Brooks, K Brooks, that's with an S, at AHA.org. If someone can throw that in the Q&A window for us, K Brooks at AHA.org. Reach out to her and she can get you engaged with that. Some of the other stuff that we're going to be looking at that we've been trying to get going here for the last couple years actually is real-time data. Right now, the vast majority of the data is all input through bills. Some of those are actually scanned and read in. Vast majority of them are actually data entered. So, you know, that's a challenge. So we're actually setting up a process now where it can be, if you've got the meters, we'll take your information straight from the meters. Ryan Ollie, your president-elect, has been part of that process and has been working with us on that. So shout out for Ryan there.
Nice.
I agree with what you just said with about Ryan. He has helped out HESNI and honestly he's helped out my organization too.
Great.
No, we are on the other side of the top of the hour, and so we just need to wrap this up, and just out of respect for everyone's time. I did have one quick question that I was hoping you can answer, and this is just for any of our attendees who might be newer to HESNI, ASHE. Can you just talk on the importance, if they are wanting to be engaged and want to be a part of codes and how they are written, what's the importance or what's the need to be members of these various groups, NFPA, ASHRAE, ICC, all these different things that impact compliance?
You bet, and I'll try to keep it real quick, but you know, Kurt, everything we do, well, not everything, but the vast majority of what we do is based on codes. So, you know, CMS adopts Life Safety Code, 2012 edition right now, and the NFPA 99 Healthcare Facilities Code. They've adopted ASHRAE 170 through 99. So all of those codes become our requirements. We have got to stop complaining and, you know, I want to say this nice, we got to stop complaining about the codes, get engaged, and make them right. You know, that's what got me into ASHE. I was so tired of having to take a fire door that was in a barrier that wasn't required to be a fire barrier per life safety code, but was required by the building code. And when my fire marshal would come in, I'd have to have a fire door there. So I'd go grab it out of the dang storage room, we'd throw it in, and then I'd take it out because I don't want to maintain it for my surveys and my inspections. I got so tired of that. That's how I got engaged. Volunteered through ASHE to be part of the ICC code committee process and got so engaged with it, they said, hey, come work for us. So not going to guarantee you a job, but that's how it happens. It happens by members who have these issues that they deal with on a regular basis, getting engaged with their chapter, letting Donnelly know about those issues that they're having so that we can then address them on a national basis and fix them. So what our goal is ultimately is to get far enough ahead that we're actually driving the code development process so that we're ahead of the whole situation and we're doing what should be done based on science and data and not this reactive process that we're in right now. So that's the goal. You know, and being engaged with your chapter is where it really needs to start. You know, that's where it all starts, because the chapters are on the ground, they're the front line, and really encourage you to get engaged there.
Well said. Well, Jonathan, I can't thank you enough. Appreciate you taking time out of your day, and HESNI members likewise appreciate you joining us for the lunch hour. With that, we'll go ahead and wrap up this webinar and look forward to doing something similar here in another few weeks. Thank you all.
Can I throw a quick thing in? I did have one person ask about this, and yes, we are recording today's session, and I expect we'll have something to download. And I think the logical place to put it is where ASHE has parked their recent thing on YouTube. So look for that soon. We'll have something to say about that. We'll have a CEU certificate, I think, for today's program too. If you would like one of those, I'm going to ask you to email the office at chapter.office@HESNI or administrator at HESNI, and I'll get one. I'll get something out to you right away. This was the first of our efforts, and I got to say, it feels so good to get one of these under your belt. I can already feel my fear turning to enthusiasm, and I'm looking forward to the next one. It's going to be February 18. We've got a two-part program on a ComEd electrical energy savings and rebate program. And the first part is going to be an overview, and then we're going to tie that to a second part, I think, on April 1st, which is going to take all these points and illustrate them with a good case study of a recent project done here with one of our hospitals in Chicago area. That's it. Thank you very much. Thank you, everybody. Kurt, your help, all your help, and you did outstanding. And Jonathan, I can't say enough for everything. It was awesome. Thank you.
And love to come back and do another one sometime.
All right. Okay.
All right.
Thank you all.